we're gently going to start. We are waiting for a few more people, but thank you so much for being here today. Just for those of you that don't know me, my name's Honor from Honor Way, and today we are here looking at talking about Kenya. Kenya is opened on the 1st of August, and Cottars, of course, as well. So we've been through a pretty challenging, to say the least, time, but we are excited about the positive news that is coming through with Kenya opening up. Cottars opened up with a small bang in August as well. We had Elliot, who came to stay and did some nice publicity for Kenya. And now what we'd like to do is just see if we can tell you a little bit about our first 6 weeks of being open, and look at some of the questions that you might have. So with me today, we've got Louise Cottar. She is, of course, Managing Director and owner of Cottars, but she has also recently travelled from the UK to Kenya and back again, and will be doing so again soon. So she's going to talk through her experience of those travels, both from here to Kenya and in Kenya. At the end, she's also going to just chat a little bit about some of the ongoing refurbishment plans that we have, to let you know what's going on as we go forward at Cottars. We're also joined with Doug, who is one of our senior guides. He does an awful lot. He looks after our 4Cs program, so we'll see him again in a couple of weeks, which is all about the conservation. But he's also looking after the implementation of the COVID-19 standard operating procedures in camp. He is based at camp, so he'll also talk to us a little bit about the guest experience. And we're also really delighted today to have a guest speaker who's Dr. Linda Thorpe, who's a consultant family physician. She's a British Kenyan physician with over 20 years of experience. She is also currently supporting the EU in Kenya in an advisory and medical role in relation to the COVID-19 pandemic. So we're really excited to have her here today to talk a little bit about the situation on the ground, and help, answer some of those questions that we might have. Just on the the work side of things, we're going to speak with Louise first, then Doug, and then Linda. At the end, we're going to run a question and answer session as always. So if you have questions, please can you pop them into the Q&A box? I know we've got the chat box as well, but if I can try and keep them in one place, that would be brilliant. So I am going to stop talking and hand you over to Louise. And thank you all for being here today. We really appreciate it. Louise, over to you.
Thank you so much, Honor, and thank you for organising this call, and thanks to all of the participants joining us today. Without an interconnected support system for our businesses, we all run challenges. So I think it's really important that these types of webinars build the confidence and trust for you to make informed decisions for your clients. And I hope today this is what this webinar does for Kenya. I traveled to Kenya in August from Europe, and our US marketing rep, Brooke Berlin, traveled from the States. We wanted to test the system once Kenya had reopened on August 1st. Between us, we flew on 5 different airlines through 7 different destinations. And so my talk is a little bit about the journey. I'm going to try and keep it really short because I think Dr. Thorpe and Doug are far more interesting than I am. So we had to take a COVID-19 PCR test prior to traveling. The test results had to be negative and taken within 96 hours of flying. In European countries, there's different methods of getting the test, whether it's through a private facility, a public facility, or a home kit. But the key is that it has to be a negative PCR certificate that states negative PCR. There are other tests like the NAA, which is a higher level test, and I think the PCR is a subgroup of that. But what the Kenyan authorities are looking for is that negative PCR test on arrival. So before flying, we had to get the test done, and we also had to fill in a Ministry of Health form which is a pretty standard form, and it sort of spews out a QR code. I would strongly advise having both a digital and a printed out copy of the QR code and the certificate before getting on your first flight. Some of the airlines didn't ask for anything, and others asked for it before boarding. So it was a bit of a mixed bag. Always good to have both on hand when flying. Remember, though, the critical thing, the test result has to be within 96 hours of the flight. Please also make sure that your guests have obviously an e-visa and the relevant insurances before flying. The Kenyan government, from what I saw, are taking COVID-19 really seriously. On arrival, on disembarkation from the plane, we were let out in tranches, not all at the same time. And we were met by a health official. We had to show them the QR code and have our temperature taken. And that was it. Then we were through normal immigration. For those that know Jomo Kenyatta International Airport, it can take 60 to 90 minutes to get through from the airplane to baggage. It took me 20 minutes this time, and it took Brooke 25 minutes. There are less travelers. It was easier than normal and quite pleasant. Throughout the airport, there are hand sanitizers everywhere. There's spatial markers everywhere. And you really did feel like they were handling the situation appropriately. Not only that, but the Kenyan government also have put in place a very robust system for ensuring that hotels, lodges, and camps have met certain standards to mitigate the COVID-19 risks. And we were one of the first to go through that process and pass, but do make sure that if you're sending guests to Kenya, that those properties have the necessary certificates from government. When leaving Kenya, we had no checks. I had no checks. That's not to say there aren't any, but I had no checks. I would suggest that all departing visitors fully understand the respective return requirements to the country that they're going to. For the UK, I had to fill in another government form, and I was quarantined for 2 weeks on return. Although it seems kind of strange because there's far more cases in the UK than Kenya. But anyway, that was the requirement upon return. So it was actually really pleasant to go back to Kenya. And to summarize, it's not that complicated. Travelers need a negative PCR COVID test taken within 96 hours of the flight. They need to fill in the Kenyan Ministry of Health form and get a QR code. They need relevant medical insurance, and they need to wear a mask throughout for traveling. So that's the getting to and from Kenya. I wanted to keep mine really short to give more time to both Doug and Linda to take it forward from here. Doug will talk about sort of some of the requirements at camp and the experience at camp. And just as the owner of, co-owner of Cottar's, we want to keep guests as safe as possible, but not spoil their holiday. So there's a huge number of regulations for Kenya. A lot of them we keep behind the scenes. The clients don't see it being pushed in their face all the time. But there are some requirements that are law, like taking a guest temperature every day. And we have to do that. And our staff will be wearing masks all the time. So I don't know, Anna, if you want to introduce or just go straight over to Doug. Doug.
Straight over to Doug, I would say.
Thank you.
Doug, over to you.
Thank you, Anna. Thank you, Louise. Good afternoon or good morning, everyone. Yes, I brought my entire team here. Yes, so it's a nice warm day in the Mara. It's nice and sunny, a very good day to actually be out on a safari. I wanted to just give you a brief description of the area for those who haven't been to the Mara. So the Mara is about 1,500 square kilometers. And we are, where Cottar's is, we're on this farthest southern eastern corner of the Mara, and we have quite a few habitats compared to the larger Mara. Yeah, so we're on this mountain ridge, and below us we have acacia woodlands, we've got open savanna, we've got a riverine forest. So we do have a lot of animals throughout the year, and it is a perfect place to be during the migration. We are the first people to see the migration. We are the last people to see it as it heads back to the Serengeti. So we are right next to the Serengeti. Things we've done are that with the help of the Ministry of Health, there were so many requirements that we had to put in place. And I was chosen to come and spearhead that. So, to make sure that we were compliant, but it was also safe, not just for our guests, but also for our staff and the community who live with us here. The first thing we did was to constitute a task team, a health and safety committee team, which we defined their roles, and the number one thing that they had to do was to make sure we were compliant and we would get the permit and the certificates that we needed so we could start operating. I made a few videos, and I will explain a little bit further. I made a few videos for you to see some of the measures that we have taken.
When I pick my guests from the airstrip, this is my safety kit. A thermogun that I screen clients every day. Sufficient hand sanitizer that we keep in each car. Small bottle that has hand sanitizer, you can keep it in the pocket. Face mask that you can wear in public areas. Water bottle.
Guest tents are thoroughly cleaned and disinfected 3 times a day, including high-touch areas.
To put emphasis on the preventative measures, we have installed hand wash basins all around camp. All our vehicles are cleaned, disinfected before and after every game drive. All our game viewing vehicles have a perspex screen in between the cabin and the rear. If guests prefer not to have it, it takes 2 minutes to remove. After guests depart for their game drives and other activities, all the communal areas are cleaned and disinfected. We have a food safety management system in place. Kitchen services are cleaned and disinfected before and after every preparation. We offer separate dining and spaced out tables with family service.
Items in our Dapper Flapper 1920s gift shop are disinfected regularly, including high-touch surfaces.
We can't wait to welcome you back to a wonderful home again soon.
So the mandatory preventative measures have been taken care of right from the beginning. When we meet you at the airstrip to pick you up, we have the vehicle has a perspex screen in between the cabin and the rear. And we're always asking our guests, do you want to keep it or do you want not to have it? Our guides will always bring extra masks for you. They will bring hand sanitizer throughout. We have water in the car, 5 liters jerrycan and soap. And every time we stop and ask our guests, to if they get out of the car, we're lucky we can be able to get out of the car and look at tracks or just get out of the car. And so we give them the sanitizer and they can wash their hands. So that has been taken care of. When you arrive at camp, you're received by the team. Immediately you arrive, we show you where to wash your hands. So the hand wash basins, which are we've put throughout the camp, immediately you arrive, you have to wash. That's step number one. Number two, we walk you into an area where we will screen your temperature, and we will record your details in the log book that we keep. Then from there, we will show you to the dining area where then you will be briefed. And these briefings are imperative, and we always emphasize on these preventative measures that we have put in place. Then from there, our briefing, even you don't fill any paperwork. It is all done online. And then from there, we take you to the rooms. When you come back for your meals, we have separate dining tables. We've made sure that for different groups, different tables, and a dedicated team. So we have a team right from your guiding team to your waiters and even to the kitchen, and that is your team that will look after you. We also try to have meals at different locations. So you're not always having your meals at the mess tent. We have other different areas that we will be hosting you for meals. Also, so every morning your guide will check your temperature before you go out on your drive. Like I said, there is enough sanitizer in the car should you stop. And for meals also outside, if you take picnics, we're doing so that we don't compromise the guests' experience. We are continuing to do proper meals outside, like bush meals, bush lunches, and bush dinners. And so we're doing this per group. So we're not. Every car has 2 guests, not more than 4. So we try not to bring in more than 4 in a car. So it is basically exclusive. Wearing a mask is compulsory in public areas. And like I said, that in the car, you will also be given masks. And the guide will always bring enough just in case you need to change your mask. We also emphasize a lot on maintaining the social distance in all these public areas. The mess tent I've explained, but it's all set up nicely so you are actually social distancing in all these social areas. So we've also set up cleaning and disinfection measures in all these areas. So when the guests depart from their rooms to go for their morning drives or any activity, the room is thoroughly cleaned and it is disinfected before they come back. Their laundry is picked up in a basket that is also washed, cleaned, and disinfected before it is brought back into the tent. The mess, also the same thing happens when all the guests leave after every activity, be it breakfast or lunch or dinner. It will also be cleaned thoroughly and disinfected. The same applies to the vehicles, like I indicated earlier. When the vehicle comes back from game drives, it is also washed, rather cleaned and disinfected before the next activity happens. We also try to separate different activities so that we can allow enough time to clean up. For example, the spa or even the Cottars Warrior School, we allow an hour or so before the next group comes in so we can disinfect the equipment. So basically, cultural visits, we organize that early in advance. So the village where we go to, they will be expecting us. We make sure there is social distancing there. We send masks to them ahead of time. So for meals, we ask our guests whether they would they would like to be hosted or not. If they prefer not to have a host who is the guide, then it is fine with us as well. For waste management, we reviewed our waste disposal policies to include the infectious waste which we are now generating in the form of masks and so on. So every room has a medical waste bin where we come and collect every day. Even the cars, we've got the medical waste bins. For emergencies, we set aside an isolation tent just in case we have a suspected case. That is where we isolate the case, and we work very closely with the Ministry of Health and the county government to ensure that we report the cases accordingly, and we also ensure that or we also work with a virtual doctor who we will consult if we need to do so. We ask our guests to make sure they've got a medical cover, an air evacuation cover when they come in, so just in case we need to airlift them. And the team, we have set up trainings for the team, so then the whole of the team and the staff, every now and then, like 2 or 3 times a week, we have these trainings, and this is to sensitize the staff and to make sure that everybody is well aware of what is happening and any new development. Everybody is aware of that. I'll be ready to answer any questions if you have any. Back to you, Ona.
Thank you so much, Doug. Thank you, that's brilliant. And it's good to know what's going on. One question, can you just reiterate, do guests need to wear a mask while they're on safari, walking or driving? We are emphasizing on being in public places. By this I mean, if you come to the 4C Center where we are right now, if you go to the gift shop, if you go to the mess tent where other groups will be, you expect there will be other people. That is a mask that you put on your mask. On game drives, we are allowing guests to, because we have a lot of space really, and you're in an open car. Our staff will be wearing the masks as that is mandatory. But we let the guests decide whether they want, because they're traveling as a group presumably. So we allow them to decide whether they want to wear it or not. Okay. Brilliant. Thank you so much, Doug. We will look at any other questions at the end. So okay. Without further ado, I'm going to hand over to Dr. Linda Thorpe, please.
Thank you. Thank you. Well, it's a pleasure to be here, and thanks for inviting me to talk. I know you introduced me, but I'll just introduce myself a little bit again. So I'm Dr. Linda Thorpe. I'm a family physician, and I work in a private healthcare centre in Nairobi. I'm also, because of the COVID situation, the European Union, who were actually patients of mine, asked for me to be an advisor on the ground. So I've been doing that since April, and obviously through that, been watching the situation both in numbers in hospitals, but also through my own experience in the clinic, which has been quite useful, you know, compared to some of the you know, the newspaper articles and things that people are seeing, just to keep some perspective on it. So basically, we obviously started in March in Kenya, and we watched the situation steadily. And there's a lot of preparation that had been going on, and perhaps slowly in some respect, but actually it paid off in the end. So the hospitals, both private and public, have gone ahead and had COVID wards set up, and COVID wards basically for asymptomatic and also those that were a bit sicker. So they were separated from both the normal patients in the hospitals. Now, the hospitals also saw a massive drop in patients coming in, which was obviously because people were quite worried about going into hospital anyway. So they concentrated on the COVID patients. Now, we basically saw a steady rise in numbers, and obviously due to increased testing as well. And then towards the end of July, there was quite an increase in numbers, and actually an increase in patients being admitted to hospital and those going to ICU beds and actually being a little bit more unwell. So that was a little bit worrying on the ground, because we also saw that in clinic with patients that were mildly symptomatic coming in and testing positive. And obviously by this stage, the hospitals then had adopted and the government had adopted a protocol that they would care for those patients that could be cared for at home, which obviously took the pressure off people that had mild symptoms and who didn't want to go into hospital or couldn't afford to go into hospital. They were then able to home care. In Nairobi and in the other counties, they basically had to, once they were tested positive, the positive results would be told to the ministry, and the ministry then would set up within the counties, the county governments, or in Nairobi, it was the Nairobi Medical Services. They would be then contacted at some point by the medical services, and then they would go to something called the Jitenge app, which is basically an app which you're able to just print off, and it's basically a bit the same as the Cottars are doing, or you know, if someone's sick, and also on day-to-day basis, check people's temperature, check people's symptoms, you know, for shortness of breath, for cough, and any other symptoms that people may have, and also to give them advice on how to self-isolate at home, and you know, safety amongst people that are caring for them, and things like that. So what, in a nutshell, we've seen here is an increase until July, and actually since July we've seen I think it's about a 17% decrease in cases, you know, over the last few weeks, which has been excellent, I think, in overall. I mean, some people are saying that we've had the peak already, and that was at the kind of end of July, which on the ground, that's kind of what it feels like. It feels like we saw, you know, it was quite hectic, it was a little bit stressful, and then it's kind of tailed off, which is great, really, despite the fact we've opened up, because obviously we were worried that once we opened up and people started traveling, that you would see a peak again, but we're still waiting to see whether that's going to happen, and it doesn't look as likely anymore. You know, when you look at the stats of for instance, Nairobi or Kenya or the African countries compared to the European countries, you're looking at a median age of about 20. You know, in Nairobi, in the cities, and compare that to, you know, 67 in Europe and things like that. So it's a much older population in Europe, which I think, you know, obviously goes to show why there's such a higher mortality in countries like that. I mean, saying that the case fatality rate in Kenya is about 1.7%, and in England now it's come down. So they've had a lot more cases, but it's now come down to the same as we are. Whereas at their peak and beyond, I think it was more than 6% that they were having in regards to case fatality rates. So I think, you know, in regards to the actual disease, you know, everyone knows what the symptoms are or what the expectation is. In Kenya, it's about 90% are asymptomatic, which is a little bit, which is about 10% less than, more than the rest of the world. 80% in the rest of the world are asymptomatic, and in Kenya it's 90%. I don't quite know why that is, to be honest. But overall, the sick people, only about 0.1% will end up in ICU. So it's a bit skewed here, and I think a lot of that's to do also, like I mentioned before, the young population that we have here, and also the comorbids like hypertension and diabetes, which have a big risk in regards to COVID, is not there as much as it is in the rest of the world. So I think maybe I'll leave it now and then just let questions come in, and then I can answer questions, and because I think, Honor, you've got some questions for me to answer. So that's kind of what I've been feeling like in a nutshell. Okay, actually, one more thing. In the main hospitals, I mean, just to give you a perspective at the moment, I only look at 3 main hospitals because, for my clients, if you like, and my patients, I look at the hospitals that I would potentially send them to, which I feel are the best and the safest hospitals for them. So that's the Aga Khan, the MP Shah, and Nairobi Hospital. And amongst them, they basically mobilized to get 338 COVID beds. So those beds are specifically designated to COVID patients. Now, I can't remember the exact number when they were kind of at their peak, but at the moment, they're only covering about 39 beds at the moment. So you can see it's a huge decrease from what they were expecting. Those beds have got oxygen, they've got what they need. The hospitals are fully set up and using kind of protocols through the CDC and the WHO, which are protocols used around the world. And they've got the specific drugs that are needed. I mean, obviously the protocols have changed a lot over the last, 4 or 5 months since it started. And the mortality rate, I think the treatment has got a lot better from what it was before. Initially, they said don't use steroids. And now actually they found that there's a lot of decrease in mortality in using steroids, for instance. So here in Kenya, we've got the correct drugs that we need if someone's very sick. And obviously, if you look at the percentage of people getting really sick, it's tiny. So, and they're following the protocol, which I think is excellent. So, personally, I'm not worried about the quality of care you would get in Kenya if you were really sick as compared to somewhere like in UK. I mean, the things that we don't have here are for the very, 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 very sick people, like ECMO machines and things like that. But, for those people, potentially one would think about, if there was time, getting people Kazavac out, if you like. However, by the time you get to that stage, to be honest, whether you're in England or, America or Kenya, you're very unlikely to make it anyway when you get to that stage of the sickness because of the way the sickness progresses. Okay, so I'll answer any questions now.
Thank you, Linda. That's great. Thank you. It's really good to get the information on the ground. I think, because I was just about to ask the one question that you actually then answered about the hospitals. Which hospitals would you recommend? And certainly knowing that there are private hospitals that our guests, because I think the big question is, what would happen if guests did get COVID on the ground? And we started chatting a bit in the pre about it, saying, well, obviously it's about monitoring the symptoms, which Doug has also explained, and knowing at what point it would be, important to medevac them and where they can then go to be treated. I think because we did cover, some of the questions. If there's anything else you think might be good to add to that question about anyone getting in the country.
Yeah, I think it's really important to look at the clients, or I would call them patients, but you would call them clients as well, the clients that you're bringing out. And I think that's where, decisions would maybe be made at the time if that patient was to get COVID or to get suspected COVID. Because obviously anybody over the age of 65, anyone who's obese, anybody who's got blood pressure problems or diabetic problems or breathing issues, those are the patients that are more at risk, and we know that without even, between individuals. So with those kind of patients, I would, you would obviously want them to be closer to a medical facility if they were to get sick rather than wait. Mm-hmm. We also know there's like an 8-day period before a patient, potentially might get very sick. So you may have somebody that's not too unwell and maybe they're getting slightly breathless, and then on day 8 they suddenly deteriorate. And so it's about really monitoring closely. And I know maybe some people won't even be coming down to stay in the camp for more than 4 or 5 days. I don't really know what your clients tend to stay there. So it really is individual and dependent upon that. I think you know, measuring temperatures, to be honest, is probably not as helpful as we think it is, because only about 41% of people will present with a fever. You know, people may have a headache with no fever, people may just have gastroenteritis type symptoms, you know, people might just have a bit of a cough and no fever. So it is helpful in some respects, and it's better than doing nothing, I suppose. But you know, the important thing would be to have an oxygen saturation monitor in the camp, so that you can monitor people's sats if they aren't that well, so you can keep an eye. Because obviously, I don't know, there's a term called happy hypoxia, where people may look and say, look, I feel fine, I'm good, blah, 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 and then you take the saturations and their saturations are not good, which, you know, represents that kind of separation between, you know, feeling well and actually not being well, you know. So the treatment for COVID, obviously, we know is much more based on oxygen requirement, so that if your saturations are down to about 93-92%, then that's the time actually that one should get into hospital or be close to a hospital in case it starts to deteriorate. Because we know that, you know, once you get there, your requirements in your bodies, you know, the body's having to work a lot harder to kind of make sure that, you know, the oxygen's in the body, and one can, you know, continue as normal. So yeah, I think, you know, I spoke to, I think I sent a list of things that would be, you know, useful in camp, which would be like an oxygen saturation monitor, and then just a set of steroids, because, you know, steroids is very useful, and some antibiotics, and that would really only be used on a doctor's advice. But at least if it was in camp, or, you know, people had access to it, then it would be an easy thing to start whilst people were being mobilized to move. I mean, obviously, you know, like I said, 90% of people in this country are asymptomatic anyway, so potentially you're looking at most people, if they do get it, will get it very mildly, and, you know, may just need, you know, what we call kind of home care. And, you know, for patients who are home care, unfortunately, most of the counties are quite inundated, or they were, or Nairobi City Council was. So, you know, they weren't getting the follow-up that they required. But, you know, for instance, for my patients, I would just ask them to contact me every day, and then we'd just have a look and see what the stats are and how people were feeling. And I think that also takes the anxiety out of it, because obviously people think of COVID, and quite a lot of people then put it together with death, which, you know, we know is not true. But, you know, humans are humans, and anxiety is real. So, you know, a lot of the COVID issues actually stem from anxiety and people not wanting to be tested as well. But that's a story for another day. Anyway, so
just very quickly, two things. In terms of international guests, I've been asked if we could type out those hospital names, but maybe what I could do is get them from you afterwards, and I can pop them in the follow-up, so that we have them. Out of those three, are international guests able to go to all three of those as well, patients?
Yeah, I mean, I use Arcon as my main hospital, and the reason for that is I also work as faculty there, and I know a lot of the doctors and the hospitals. And obviously, for me, for, you know, clients that I have, then I'm able to, you know, to basically manage them better, you know, so that it takes away some of the hysteria, if you like, of going to hospital, being in a different place, and all of that. You know, the other hospitals, you know, the MP Shah I'm very closely in touch with as well. I know the person that runs the ICU and things like that, because that's how I've been getting a lot of my information. So, you know, I am a bit biased, and I'm not gonna lie there, but I would do Aga Khan, you know, as my first choice. And then I would do the other hospitals depending on needs must, and also people's expectation. But they all take international insurance. You know, Aga Khan's got a helipad. You know, Nairobi Hospital, I think you'd land at Wilson to go there. So it depends. You know, there's lots of accessibility to all three hospitals, and they're all following very similar protocols. And in fact, interestingly enough, I spoke to a doctor who's running the Kenyan National Hospital casualty as well, because obviously you always wonder whether we're seeing the real deal or not. And actually they also said that they've seen a huge decrease in patients recently. And, you know, the way social media is, we would know if we were, you know, not aware of what was going on, because people tend to post things anyway, regardless. So, you know, the current situation here is much, much calmer than it was, let's say 6 weeks ago. despite the international travel increasing and despite people going off to the rural areas and things, which is what people thought would happen, is that maybe there'd be another spike when that happens. But currently we're sitting on, you know, infrequent. I think I was seeing about maybe two patients a day that with suspect COVID, and now, you know, I'm probably seeing one a week, you know, so it's really decreased a lot.
Anna, can I just add, so for our clients, if you send any guests to us, we do have a virtual doctor access point where our guests can check in daily and get advice, and we can follow that advice and obviously the medical support behind that. AMREF have a air evacuation system specifically designed now for COVID-19 worst case sort of patients, and so I do think that we have the facilities in place should the rare chance happen that someone gets COVID-19. The other thing I'd like to say is that many agents, particularly from the States, but many agents book clients into 2 or 3 different hotels or lodges throughout a 10 or 14-day stay. We're encouraging a stay longer arrangement where they stay in one place, they have the same waiter, the same room steward. You know, there's so much to show in the Mara. There's no need to get on 3 additional internal flights and mix with many different staff. So we do have a stay longer package that I think would serve well in this COVID period. Linda, I have a quick question for you. How many cases have there been in Kenya and how many deaths, just to put it in perspective compared to Europe?
Yeah, I did write this down. I'll just have a quick look for it. So currently we're standing at 36,205 cases as of probably yesterday, and then deaths 624 deaths. So, you know, it's not as much as obviously other, you know, places like UK and have seen, and that's, you know, I think, regardless of the fact that we aren't able to test as much as everybody else is, we're still not seeing that splurge of patients coming in very sick into hospitals and things, because, you know, even if you said, well, you can't test as many, those that were sick would still end up in hospital with respiratory, you know, issues and other issues, and we're just not seeing it. So yeah, we're not testing as much, but that means our death rate would go down as well when we do test as much. So I think, yeah, you know, maybe the reasons for that's probably the fact that we've got a younger population, as I mentioned, and also, you know, people, you know, outdoor much more, fresh air much more, you know, things like that. So yeah, I mean, and we are, you know, in Kenya, a lot of people are wearing masks, are trying to wash hands, are trying to keep social distances as much as possible. Obviously in other places it's not as easy, but I think, you know, we started that back in March, which I think has also helped. You know, the interesting thing was, because I was doing a little bit of research about it, and they did they checked 3,000 blood samples, and they found that in the age of and I have to find it on one of my papers here, on the age of 15 to 64, 1 in 20 are already immune. You know, so 1.6 million people in Kenya supposedly have antibodies. So so I think there's, you know, there's a lot of research. Obviously a lot will be said, you know, maybe in a year or 2 years time, when actually more, you know, evidence comes out, because people are still doing a lot of research based on all of this, as we know, you know, in regards to treatment. But, you know, treatment, if you look at treatment, for instance, that hasn't changed in the last I would say 6 weeks in regards to what they're doing and things like that. So that's also very helpful. It means that we've got to a place where we're, you know, able to treat people and you know, the, you know, make the mortality has gone down. So that's quite good.
Just one question from me on, well, actually from someone else, on when they are, if they are in hospital,
yeah,
what can their relatives, what are the restrictions in terms of visiting, or, you know, relatives that might fly out? Are they allowed to visit them, or is it no as well?
I mean, there's much more restricted, obviously there's much more restricted visitation hours and basically movement within wards and things like that. So people are, you know, obviously you do your mask and gloves and apron and stuff, but yeah, they're not stopping people from being visited per se. Obviously, if they're in an ICU, that's a totally different matter.
Sure.
You know, so, you know, from ward, I think it's, yeah, they're not stopping people from going in. They will limit, obviously, the amount of people, you know, per bedside. I think it's only one or something. Yeah, and you can rotate. But they're trying to limit, because obviously, you know, the spread within the hospital also has been issues in this country, you know.
Thank you. I'm going to give you a little bit of a break for a second, because we've had a couple of other questions come in. So I will just share the load a little bit whilst we just wait. So any questions for Linda, please send them through. But in the meantime, one for you, Louise, please. How was the experience through Wilson and onto the domestic airline? We're just talking about the domestic airline. Have there been restrictions on numbers on those internal flights?
The flight that I was on didn't have a full plane, but the whole process was very social distance. So there were markers outside the domestic airline. They were only allowing so many people in to wait for planes. The plane was disinfected before we got on. We had to wear masks. We had to do hand sanitizer before getting on the plane. So I thought it was really good. However, I don't think they're leaving seats free. So although our flight wasn't full, I did ask when I was there, and it didn't appear to be the case. You know, if it does get busy, it seems like every seat will be full. But all of the protocols, more than I think I saw at Heathrow, were being applied even for the domestic air flights.
Okay, and then for another question that came in is, what about I mean, we're obviously encourage our longer stay, but for guests that are going from camp to camp, so also in Brooke's case, she came from Muljogi down to Cottars. How does that work when you're going from one place to the next, and indeed staying a bit longer in country?
So each lodging camp would have their respective sort of health and safety protocols. We have a private airstrip, so if required, you know, there's no need to be at busy places when you come and stay with Cottars. And we've got a very big private conservancy, so we do have the space. But in between, you know, we work with agents to figure out that in between bit, and the other properties as well, to make it as smooth and safe as possible. It's sort of specific to each case.
Sure. And then there was one question that obviously in camp we are taking all the protocols as you know, that we've had to following all the guidelines, but at the moment that means that it's a private vehicle per group booking. Is there any extra cost for that?
No, there isn't. You know, we're doing it for as long as we can. I mean, if we're in a perfect situation where we're really busy and there's still COVID, then we'll need to buy more cars. But we're not at that point now, so we can guarantee private vehicles. And I would hope if we get to that point, then we can still do private vehicles. But you know, hopefully by next July, August, we'll be through the worst of this. So for right now, when clients come, it's private airstrip, private dining, private vehicle, private guide. We try as much as possible to keep a waiter, the same waiter in the same room steward as well, to minimize interactions and contacts.
So that answers the most recent question that came in going, Doug mentioned maximum 4 people per vehicle. Is that single parties only, or would you mix 2 couples? So at the moment it is just for private groups.
Correct, yeah, we wouldn't mix.
No, okay. It says here, is Cottars deciding to operate on, say, a 50% occupancy, or are you happy to cope with a full camp? I ask only because some other places, not specifically in Kenya, are operating on lower number of guests to make handling them a lot easier.
Yeah, so for right now, we've taken out some of our tentage options to keep the numbers low. I think we would answer that as and when it happens. If occupancy or the demand was increasing, it would be dependent on the COVID situation at the time. and the medical advice that we were getting, both from the private sector but also from government.
Okay, thank you. Louise, do you want to tell us just a little bit also about the refurbishment planning that is ongoing and just the latest, where we are there as well, just while I see if there's any other questions coming in? Be nice to hear what's happening.
Sure, and just to say to everybody that, you know, these are uncertain times, and whatever we can do to build confidence and make it safe, we will take those steps. So if you have questions, Calvin, myself, Honor, you know, we are available to answer them anytime, whether it's with you as an agent directly or with you and your clients. You know, we're here to try and support the whole channel and build that confidence. So please feel free to call on us. Despite everyone cutting costs everywhere, we had initiated a refurb plan pre-COVID. It got stuck in a container, but it's on its way now to Kenya. So before Christmas, we are refurbing our mess tent with a new bar, a new library, some new dining facilities. We are refurbing our E4C center and a honeymoon tent. We also, because it's critically important to surviving, will have a new mobile gin bar, which we can take on safari, because that is key to surviving all of this, we've decided. So the gin bar is one of our refurbs as well. I think I've covered everything, Honor.
Thank you. I've got one more question for Linda, please, which is, if the UK cases continue to rise, is there potentially a point where Kenya will decide it will close the borders for the Brits again? Or does the fact that we have to turn up with the negative test that has been taken within 96 hours reduce the risk sufficiently?
Yeah, I think they're not going to, well, it'd be unlikely that they're going to close the borders. Obviously, everything's being looked at on a monthly basis. So, you know, really I could say, you know, no, they're not going to do that. And they you know, potentially they could, you know, anything's possible depending on how COVID goes. I mean, it seems almost a bit farcical that you know, we would close the borders, you know, that England closes the borders to us slightly, and we've got open borders to them, considering the caseload that we've all got. But I mean, that said, I think that you know, the government, you know, I'm just talking on my own judgment here, is that I don't see why they would make retrograde steps now that they're going forward, and things are, you know, in Kenya seem to be decreasing and going stable. And as long as people have got a negative COVID test, you know, then I think that would be, you know, adequate. What may happen is that they may then say that you have a negative one when you come in, and then maybe you need to get a negative one again, you know, if you're staying for longer than, you know, maybe, you know, a period of time, just because we know that most people are going to get COVID by 11 days, you know, 97.5 will be positive. So it'll be very interesting to see what the whole world does with that kind of new information that's coming out, and whether, you know, they're able to decrease quarantine in other places as well. But yeah, in a nutshell, I would say no, I can't see that they're going to go back on that.
Okay, thank you, Linda. I've just had, this is probably a general one, which I actually just received an email about. There was a question about information or an insight into the flights between Kenya and Tanzania, and when the tit for tat will be resolved. Are they working on this? I have just had a statement, a press release through, which confirms that the government of the Republic of Kenya, through its circular issue, it basically is removed the requirement for a 14-day mandatory quarantine. In view of this, on a reciprocal basis, Tanzania has now lifted the suspension for Kenya operators. So for the purpose of this release, therefore, the resumption of air restoration of flights for all Kenyan operators is with immediate effect, has been informed accordingly. So I can find out a bit more information and send that over to you. But as far as I can tell, it has been resolved today. Another question for you, Linda, is, are there any further vaccination requirement recommended mandatory over and above the norm during this time?
No, I mean, they're not saying that there's any requirements that you need to have a flu jab or you need to have pneumococcal, which would be the most sensible ones to do, especially if you're of a certain age anyway. But they, you know, to be honest, there's no more requirements, just the usual vaccinations that you need, and that's it.
Okay, brilliant. Right, I think we are doing all right here. Are there any other questions for anybody? I got asked where I was, but unfortunately I am in Windsor. I would love to be in Kenya. But I think that's pretty much. Dee Dee has said that she's coming for the gin bar, so fantastic, can't wait. So that's a positive. Someone else said, I'm loving the gin bar idea, so that's brilliant. So I think you're on a winner there, Louise. This is the answer to it all. I will be sending out terms and conditions and standard operating procedures, and I will also put together a little summary of all that Linda's shared with us today as well. And I think all that remains to say is thank you so much to my speakers today. Dr. Linda Thorpe, thank you so much for sharing this time with us. Louise, thank you. And Doug, thank you, and the team over there as well, which I feel like waving at. But of course, also a huge thank you to everyone who joined us today. If you do have any questions, then please just email me. As I said, I will send the follow-up through, and if you don't have my details, that will give that to you. We've had lots of thanks from everyone else, but I will leave it at that. We're going to cover another webinar in a few weeks, which will look at Cottar's conservation and also the long run, which I hope will prove interesting. That is on the 14th of October. And on the 30th of September, I will be covering a similar webinar on Zambia being open. So I'll certainly send out details. But thank you very much, Louise, Linda, and Doug, and team. And thank you, everyone, for joining us today.
Thanks. Come to Kenya.
Yes, exactly.
Yeah, thanks for having me. And I'm definitely coming for the gin bar, Lou.
Thanks, Linda. Bye.
Bye. Bye. Thank you, everybody. Bye-bye.
Bye.